right. Dr. Pappas here with Jeremy from Bonavita PT to talk about a very common injury in the knees called meniscus tears. So meniscus tears are very common, and they happen, generally speaking, for one of two reasons. Either there's some trauma to the knee and while the patient's squatting, or while they're twisting in some way, or meniscus tears can actually be degenerative over time tears that occur. Signs of meniscus tears can be that patient is having pain either on the inside or the outside of the knee. It can be associated with swelling. Patients may also have mechanical symptoms. Jeremy, can you talk about those for a moment?
Yeah, absolutely. Mechanical symptoms for a meniscus tear they're intriguing because they're not always consistent. A lot of patients with meniscus tears will get clicking, snapping. The worst case scenario for most patients is catching, in which case they either bend their knee or straighten their knee to a point. The meniscus slips under into the joint space and just locks their knee out completely. So they get jammed up. Generally, patients tell me it's really painful. I've been blessed not to have one of those yet, so I'm hoping to avoid it. But on average, it's usually real specific to either the inside or the outside, wherever the particular tear is. There is the odd occurring posterior meniscus tear, which are they're not taboo, but they're hard to diagnose because they're hard to get the knee into that joint, in which case it's kind of diffuse joint pain. And on average, you get a lot of weakness, you get muscle atrophy because things hurt, and your knee swells up like a water balloon, basically.
So what happens if you have a meniscus tear, or if your doctor suspects you have a meniscus tear? They'll either get imaging, either an ultrasound or an MRI. Should be able to diagnose the meniscus tear, or the patient, or sometimes a physician will just start you on a course of physical therapy. Some physicians combine this with a steroid injection to try to get the pain under control initially. Jeremy, can you walk us through kind of like what an initial physical therapy program for a meniscus tear might consist of?
Sure, absolutely. Most initial PT care is going to be as little full body weight bearing through that joint, basically trying to allow gapping of the joint to allow movement to occur throughout the joint space. So doing our best not to trap the meniscus or pinch it tighter, potentially tearing it. Also reducing inflammation. So icing, some patients, it sounds backwards, but really do well with some heat to loosen up the joint a little bit. Light strengthening until they can start walking with full knee extension and normal gait patterns or normal walking patterns. And then if we are hopefully successful, then getting into strengthening things like sitting and standing squats, basically, or run-of-the-mill gym exercises to try and get that back where it belongs. If not, then I send them to a doc like yourself or back to their primary.
Yeah, that's right. So, a good course of physical therapy initially for 6 weeks is typically around my time frame, because I figure by that point, we'll know how things are going. You'll either see the patient is getting a lot better in therapy, or they're not. A lot of patients do get better initially with therapy, and a fair amount don't as well. It's my experience. So, and what happens if the patient undergoes PT and they don't get better? From my perspective, essentially the patient has a couple of options. One of those options is the traditional route, which is surgery, arthroscopic surgery with a camera and a knife that cuts out a portion of the meniscus that's torn. I'm not a big fan of this approach as long as the patient can unlock their knee. And the reason is because when you take out a piece of meniscus, that piece of fibrocartilage, that cushion in that area, is no longer there. And that a lot of studies have shown, particularly in the last 10 to 12 years, that it accelerates the development of osteoarthritis in the knee. over the long term. So what I tend to try to help patients with who are good candidates is either doing a regenerative procedure using their own platelets or their own cells from concentrated bone marrow. Now, typically what we're doing is injecting these cells that are designed to start healing process right into the meniscus where it's torn. I also inject the ligament right at the edge of the meniscus because it kind of holds that tissue into place a bit. And then we send them right back to Jeremy or right back to the physical therapist in order to get blood flowing to that area, get those structures compressed. What kind of physical therapy program would you do for somebody who's just had a procedure where we're trying the regenerative approach? They didn't get better initially, so we're doing that intervention, and now they're back in the PT setting.
I mean, some of these are going to be doctor specific. So if a doctor wants me to avoid activities to allow what they did to do their work, I'll follow those protocols and things like that. Some docs are like non-weight bearing for a couple of weeks. Those used to be the big protocols 15 years ago with the meniscus removals, or not removals, but they cleaned it. Still, it's going to be working on getting that range of motion back. Going to be trying to reduce. I mean, there's not going to be a lot of inflammation because you're not physically going in and removing stuff. At least that's my understanding of that procedure you're referring to. But really, it's going to be trying to increase blood supply into that area, really stimulate the body to get in and start healing and integrating the new substance that you're putting in there to mend that meniscus as best as humanly possible and as quickly as possible. Is there a time frame for the injectables that you're using on that for quote best results? That one I'm curious myself.
Right. So typically I like I'm a little bit more aggressive in the protocol. I like patients with PT. They do have swelling, but it goes away, typically 36 hours later, 36 to 72 hours after we're done. And I like to get them in to see you, within about a week or so, and then already start them on weight bearing or load bearing exercises pretty much right away. But the difference is where are they going to be doing the squat from, right? So the very beginning, they're very high, they're not bending, they're not going deep. And really, in my experience with these procedures, you can basically track the patient's progress from how deep they're telling me they can squat without pain. And it will start off, if they've got a big meniscus tear, they're not going to be able to do any squatting without pain. It'll start off, 15 degrees, and then we'll get them to 30 degrees, 45 degrees, 60 degrees, and go from there.
Awesome.
So recently I had a patient who get a follow-up MRI after we treated his meniscus with his own cells from his bone marrow. And I just wanted to share his results. Jeremy, can you see my screen okay?
I can, yes.
Okay, great. Yep. So this is an MRI of his knee. This is the medial or inside meniscus. And there's a large complex tear in that meniscus, and all of the remaining tissue is swollen. So he was considering doing a surgery, and for a tear this size, really what they're doing is they're removing basically this large piece of meniscus. And as I said, especially in a tear this size, it's going to predispose him to arthritis at a much quicker pace. And this is a young patient. He's in his 30s. And then so we got a follow-up MRI after the procedure a few months later, and we can see a lot of improvement in the quality of the tissue in that area of the tear, and we were able to basically save him from undergoing a surgery. So a nice success story for that patient. I'm gonna stop sharing there. I just wanted to have everybody look at that visual. So thank you guys so much for tuning in with Jeremy from Bona Vita PT, and myself, Dr. Pappas with Regenexx Tampa Bay. You guys stay safe. Have a great night. Take care.